Today is an exciting day because we got in our shipment. My friend Danny's going to help me with this press conference. We got in our shipment of pediatric vaccine for COVID, and there's been, quite a wait to get our littlest ones vaccinated. So it's a great day. I'm joined here today. That's Danny. Danny's 22 months, and he's joined by his sister Butterfly. She's 3 years and 4 months, and their older sister Monica, who is 9 years old. And their mom, Dr. Juarez, is here with them today to get her two littlest ones vaccinated. COVID remains a serious issue in our community, and many individuals continue to get sick and face ongoing impacts from long COVID. That's the residuals of COVID that tend to not go away with some people. Children have faced numerous challenges over the last 2 years and have had limited protections from a virus that can be serious for people of all ages. And so this approval from the FDA and the CDC of a vaccine for kids 6 months old through the age of 4, remember we've already been able to vaccinate kids that are 5 to 11, is a much anticipated and welcome protection for children by pediatricians and parents alike. And I encourage all parents to reach out to their children's doctors or visit one of our DCHHS clinics or another location providing vaccines in the coming days to get their child started on vaccination. These vaccines have gone through rigorous testing and review, and they've been found to be safe and effective in clinical trials. Our COVID cases here in Dallas County have gone up 24% over the last week, and youth cases have increased by nearly 30%. Now the numbers are still low, but yesterday across North Texas, we had more people with COVID in the hospital than we've had in the last over 3 months. It's the highest day that we've had since March 14th yesterday, and usually there's more admissions on a Monday than people there on the weekends, and today is kind of our Monday because it was a Juneteenth holiday for hospitalizations, that is. And so experts continue to predict risk from future variants and waves. So getting your child vaccinated now is the best way to make sure they are protected going forward. Now, depending on which vaccine you select, and Dr. Wong and Dr. Evans will talk more about that, it will either be at 2 primary doses over about a month, that's with Moderna, or 3 primary doses over 3 months, and that's with Pfizer. While both vaccines are approved, safe, and effective, considering whether you and your family can accommodate 2 or 3 visits and the overall timing are important considerations. The White House COVID Response Coordinator and the CDC have announced more locations for pediatric vaccines will be posted to vaccines.gov in the coming days. So if you're not seeing a location that's convenient for you, keep checking. Now, here at Dallas County Health and Human Services and at our locations in other parts of the county, our nurses will be vaccinating all ages, 6 months old up to 100. And we have vaccines to do that. We'll be getting in more as the days progress. Most of the pharmacies will have, like the big chains like CVS and Walgreens, will have selected locations that will handle 3 and 4 year olds, but they're unlikely to have any that will handle 6 months to up to 3. You're probably going to need to come to us or your pediatrician for that. And don't forget, if you're going to get your child vaccinated, check if your older child or you are due for a booster when you're in there anyway. Everyone 5 years old or older is due for 1 booster. And everyone 50 years and older, and those 12 and older who are immunocompromised are eligible for 2 boosters. And so vaccination and boosting is the best way you can protect your family and your community from COVID. I want to turn it over to Dr. Wong.
Thanks, Judge. As the judge mentioned, this is a major milestone for us. Certainly many parents have been waiting for this. and in this, the under 5 have not been able to get the vaccine up till now. I think we've identified just in Dallas County, and I'll show some other slides here in a second, about 23,500 cases in Dallas County that have been in kids under age 5. So this is important, and it's a major sort of milestone for us to now be able to offer this. I do want to show just a couple slides. This is, as the judge mentioned, the dosing differences for the Pfizer for kids who are not immunocompromised. 2 doses initially, then about 3 weeks to 8 weeks apart, and then the 3rd dose after 2 months or another 8 weeks. And so for the Moderna, it's only a 2-dose series, so the first dose, and then you can get the second dose after 4 weeks or 4 weeks to 8 weeks. For those moderately or severely immunocompromised, then there's this dosing schedule that's shown here. Next slide. As I mentioned, nationally, over 2 million cases among children aged 6 months to 4 years. And we've said, it's been said that in kids it's pretty mild, but still there's risk of severe illness. More than half of the hospitalized kids aged 6 months to 4 years had no underlying conditions. COVID-19 associated hospitalizations among kids aged 6 months to 4 years have similar or increased severity compared to older children and adolescents. And the burden of COVID-19 associated deaths in this group is similar to or exceeds that of other pediatric vaccine preventable diseases. And one point is prior infection may not provide broad protection against these new variants that are circulating. So even if the child has had a prior infection, get the vaccine. It's still important to do that. And again, the pandemic continues to have significant impacts on families. This is the COVID-19 weekly case counts per 100,000 among children aged 0 to 17 in the United States, going up through June 14th. And as the judge mentioned, in the last several weeks, we've just continued to have a steady increase in the number of cases and consequent also increase in the number of the burden on the hospitals and hospitalizations. Now, the numbers are much lower than we've certainly seen at the peak, but we're seeing that steady increase, and so it's definitely concerning. And we know that a lot of the test positives aren't being reported because there's so much home testing. And I'll bet every one of you probably knows, I know more and more people who've been very careful throughout, have not tested positive, and now most recently are testing positive. The circulating variants that are out there right now are extremely highly transmissible and so easy to transmit. And so for the kids, not only for them, but that protection and prevention of further spread among their family members and others who may be even more vulnerable. Was that the last slide? Oh, one more. Okay. It's also COVID-19 is now one of the leading causes of death among children 0 to 4 years. And you can see the rank of it as a cause of death among infants less than a year. It's ranked 4th. From 1 to 4 years, it's ranked 5th leading cause of death. So again, this is still a very serious thing to consider for younger kids. There is still serious illness and complications and death that can occur in this age group. So again, it's very exciting now. As the judge mentioned, please, have them, parents, talk to your physicians about it. We're offering it here, right next door even, starting this afternoon, although we're going to go full steam tomorrow. We got 2 shipments of 1,000 doses each of the Moderna and Pfizer that just came in this morning, so we're making sure everything's all in place to get that administered, and it'll be, again, full force tomorrow at all of our DCHHS clinics. You can make an appointment online, and you also, it's free to the public, and we're also giving the $25 Walmart gift cards for every child who receives the vaccine. So please, it's being fully vaccinated and boosted is the most important thing that all of us can do. If you're not haven't had the primary series or haven't gotten your booster and you're eligible, please get it. And now we can do this for kids under 5. Thanks.
Thank you. I'm Dr. Amanda Evans. I'm one of the attending physicians for pediatric infectious disease at UT Southwestern and Children's here at Dallas. And I've had the privilege to be an attending physician there for 10 years, and I've taken care of children all the way from birth to adolescence with COVID-19 infection during the past 2.5 years now during the pandemic. Many of these children have required intensive care, requiring ventilators, requiring oxygen supplementation, a breathing tube, or even just trips to the emergency room. I've been counseling their community pediatricians. I've also been the recipient of just family members and trying to help with sick children. I think that any parent has experienced a fevering child at home and had to take time off with a sick child, and that is a burden to the family in and of itself without experiencing a hospitalization. We now have had a number of these COVID vaccine doses that have been administered throughout the U.S. This pediatric dose is a smaller version of the same formulation, and millions of doses have now been given safely throughout the U.S. So I think that we now have given an opportunity for parents to have a tool to prevent hospitalizations, ER visits, in these younger age children. We have seen through the CDC data that hospitalizations from 6 months to 4 years are now rising in our community as compared to the older children who are now have had the opportunity to be vaccinated. So I look forward to encouraging vaccination among the parents of my patients, and also with this vaccination effort with Dallas County. Thank you.
All right, Dr. Juarez, want to say anything? Yeah, she's not only Dr. Juarez, she's mama.
Hi, I'm Alice Juarez. I am a physician, but I'm here as a mom. And I'm really excited that our children can get vaccinated. My 3-year-old starts pre-K at Dallas ISD in the fall, and that is one of our biggest concerns. With our 9-year-old already enrolled, we did run the risk of her bringing COVID back to us. We've been extremely vigilant throughout the whole pandemic. None of us have gotten COVID yet, and we hope to maintain that way. But if we do want to have the backup of the vaccine. So we encourage all parents to please vaccinate everybody eligible, and it's free. So, you know, these health risks increase everything that we can to help our children, right? Just like we buckle them in, we should vaccinate them.
En español, ¿qué le diría a los padres?
Que los vengan a vacunar, por favor. No nada más es para el bien de la comunidad, pero también para tu hijo en particular. Muchos padres estamos esperando esta vacuna y estamos muy ansiosos de que nuestros niños tengan la protección. Hay familias, muy pocas familias que tenemos, que podemos decir que jamás hemos tenido el virus, y pues tengan o no, hay familias que usan la excusa de que ya fueron contraídos contra el virus, pero sepan que la vacuna también ayuda aún más, aunque hayan tenido la infección o no. Entonces, para también prevenir los efectos prolongados del COVID, todavía tienen toda una vida por delante estos niños. Así como protegimos a los ancianos, hay que proteger a los bebés. Yep. Thank you.
Josh, sorry. Can you tell us again the protocol when the parents can bring their kids beginning today, is tomorrow? Can you tell us the protocol? They need to do online registration. Can you tell us about that?
Sure. So you can go to vaccines.gov and find a place near you. You can, as far as signing up with us, I'm going to let Phil or Dr. Wong answer that question. Dr. Wong?
So beginning today, they can do that?
You know, we close at 3:30 today, so there's not a lot of time left here, and we were only doing it at this facility. But tomorrow, again, you can make appointments online for tomorrow, and it'll be at all of our immunization clinics for DCHHS. You can check, as the judge mentioned, on vaccines.gov for some of the pharmacies. Not all pharmacies, I think, are offering it for under 5, but some are. And check with your pediatrician
And how
also.
do they make it online with us?
What's that?
How do you make it online?
Oh, online. It's on our website. So there's, off the county website, a place to make an appointment for your vaccine. And just fill out the form and make the appointment.
And our website, if y'all want to, and it would be helpful if you would put that on your broadcast, but our website is dallascounty.org. So, any other questions? Yes?
What reassurances do you have for parents who may be hesitant?
So, yeah, I want Amanda to answer that because she is a pediatric infectious disease specialist. But I will just tell you, as a father and as a leader who's worked on this, there'd be no way that I and Dr. Wong would be standing up here encouraging people to get their children vaccinated if we had a concern that it was not safe to do so. And as you can see from these numbers, it never gets above the 5th leading cause of death, and in some of those age brackets for our little ones, it's the 4th leading cause of death. So it's very important that we do all that we can to protect our children. As Dr. Juarez said, we buckle them in. That's one of the ways we keep our kids safe, and we get them vaccinations. And we get our kids vaccinations without even really thinking about it. The doctor says it's time for a vaccination, so we get that vaccination. But those vaccinations that we've been getting our kids are not as likely to get them really sick or take their life as this disease. So there'd be no reason to wait. But let me give it over to the expert.
It's very understandable that parents are wary of new products. These vaccines, the COVID vaccine in the trial for Moderna and Pfizer, have very similar side effects to normal childhood vaccinations that we give our children. So fever, warmth, and tenderness at the site are the most common side effects. There were very, very few serious side effects that were seen in these clinical trials, and the serious side effects were very high fever that were seen. These are also common side effects that are seen with our childhood vaccines. The side effect that is very concerning for parents of inflammation of the heart was not seen in these clinical trial with these young groups. These children are going to be have ongoing surveillance, and there's also surveillance for anybody who receives a vaccine through the VSafe and other vaccine safety measures and reportable surveillance tools.
There are those who say, why are we still talking about this? This pandemic is over. The absence of masks, the social gathering are indicators of that. What would you say to those people?
I would say that the young children, the youngest of these children, and including the children that have been born during this pandemic, don't have the ability to utilize the masks that we adults protect ourselves with. And so vaccines are the tool that we need to protect them. COVID is still circulating, and hospital rates and ER visit rates among the youngest children that lack vaccine efforts in that group are rising as compared to adults. And in the US, 2/3 of adults are fully vaccinated. So we have turned this basically into we're shifting it into the pediatric age group.
Any other questions? Caroline, yes?
Dr. Wong touched on this briefly, but if you could kind of reiterate, so many kids in this population have had COVID, by going to daycare and preschool. For parents who maybe feel, well, my kid already had it, they were fine, and don't feel the urgency to get vaccinated, what would you say to them?
Yeah, no, absolutely. We've identified 23,500 kids under 5 that we've had records of their positive tests, and we know that just having COVID does not provide that protection. There's waning protection. It's important for kids in this age group, even if they've had COVID before the infection, to get the vaccine. That's for the best protection.
Any other questions? Thank y'all. And now, we'll get you guys, we're gonna go ahead, guys. I think we're gonna, since these are our youngest patients that we've had, we'll probably vaccinate the kids off camera, just because it'd probably be a nicer thing to do. So thank y'all all for coming out. Now, one good thing, as y'all may know, and for your parents out there, if anybody's watching this on the internet, when you come to Dallas County Health and Human Services, your family, or your child rather, gets a $25 Walmart gift card. You can buy a lot of candy and a lot of toys with $25 gift cards. $25 for a guy Danny's age goes a lot further than it does for an adult. So come on in and get your child vaccinated and get them their Walmart card. Thank y'all.